We're back here on our program, The Platform, and it's an interesting program today because in this segment of the program we are going to be dealing with regenerative medicine and stem cell therapy. And we've had Dr. Nina Graham here before, and it's good to see you, ma'am.
Thank you.
The last time you were here, we were talking about cervical cancer.
Yes, sir.
And today you brought along Dr. Damien Gordon. How are you?
I'm doing well.
Very good. And what is your specialty?
Well, I am a family physician, but I have done quite a bit of training, and I'm now looked upon as an aesthetic medical practitioner. And that's because it used to be known as aesthetic derm, but I've gone so much further because I'm doing aesthetic gynecology, urology, all of it. So they just brand me as aesthetic.
What is aesthetic gynecology?
That's where we actually plump and... Well, go ahead.
Oh, yes, yes, that's my area.
Yes, yes. Well, what is that?
Actually, the Cellular Medicine Association, of which we're a part of, he is actually my trainer. He trained under the person, vampire, the inventor, Dr. Charles Reynolds. And he invented the Oshot as a part of, well, they call it vampire. And the Oshot is basically, actually I got into it because I actually had a patient who asked me if I do it. And I didn't.
What?
The Oshot.
Oh.
And I didn't know what it was, and I started investigating. And it's basically for women who suffer from vaginal dryness and painful sexual intercourse. It's more in the perimenopausal, menopausal period, or persons who have had chemotherapy, or persons who have had, or women, sorry, who have had surgical menopause, meaning they took out their uterus and ovaries and so forth, so they went into menopause. So they have all the symptoms of menopause, and the one that aggravates them the most is the vaginal dryness. It also helps with low libido, women with urinary incontinence, lichen planus, lichen sclerosis, and the Oshot can also be used for, well, along with the Oshot, or the Oshot alone can help with vaginal tightening. So I actually, you know, being a gynecologist, I was interested specifically in this area, and then I just kind of branched out when I found about the other stuff, because of course you can't fix the woman and don't fix the man.
Yeah. So how you fix the man?
Well, I'll let him go into that. He has.
Well, just to add on a little bit, there is a lot more to the female aspect, because we also do plumping. So deflation of the vulva is something that happens as a woman ages. So we could actually change the appearance, make it look like you're 20 again, right? By reinflating the lips and changing how everything looks.
How do you do
Vampire.
that?
Oh,
With
vampire,
needles.
Yeah.
With needles?
Yes.
No surgery, and it's completely pain-free. You don't feel it.
So what is in these needles? What kind of medicine
So
do
let
you
me
use?
explain. So what happens with these procedures? So firstly, let me tell you what they are. So we have hair restoration, vampire hair restoration, vampire facial, facelift, neck lift, breast lift, nipple lift,
Wing lift.
wing lift, vampire also.
lift?
Yeah. So that does the aesthetic appeal for the vulva, and it also assists with treating vaginal dryness, right? Then we have the O and P shot, and there are a few others which have just recently been commissioned to assist in the whole formation to deal with, you know what I mean, and the other part of the population, like our homosexual population, where you have fecal incontinence and other problems. So we're now looking at providing a procedure to assist in that light, right? Going further, you know what I mean, there's so many other things. So how do we...
This is a very interesting aspect of medicine.
Yes.
I thought so too.
Yes.
That's why.
Yes. How you got involved in this?
Well, truth be told, I got into all of this because of my mother. My mother was a lady, and she was like, find a way, right? So my interest, let me see, how do I explain? I was doing emporiatrics, which is travel medicine, and I was a part of the Royal College in Scotland. So while there, some of my friends were like, do this Botox thing. And I was like, I don't want to do Botox. I want to do medicine. So curiosity kills the cat. You ever heard that saying? Mm-hmm. So being curious, I went and I did the Botox and filler training, and I was blown away. So I then registered with the college, and I did the entire derm program. So I learned straight up to expert level Botox, expert level fillers, pre-stem cells in aesthetics. And you know what I mean? I just went crazy. I learned chemical peeling, this, that, the other. And that was when I realized, oh wow. And all of this started from my mother. She was like, find another way. Right? No, she was diabetic and had a host of problems. And let me tell you, I just went crazy.
I see. So you believe that there's a good market for this in the Bahamas, is
Yes.
regenerative medicine?
Yeah.
Why do you say so?
Because, well, mainly the patient that I spoke to you about that asked me about the Oshot.
Yes.
And then I have had a lot of perimenopausal, postmenopausal patients that came in with similar complaints. I mean, they also complain about the hot flashes and those types of things, but the complaint that affected them most was that. And a lot of marriages, especially if you don't understand, a lot of marriages break up because of it. And so, hey.
Yeah, I could speak to that effect as well. I've been a teacher now for something like 4 years, and I've had the pleasure, I could say, of visiting many countries and meeting a lot of wonderful people like Nina. And I give them my story, and let me tell you, I've had big, strong men come into me, and when my office door closes, they start to cry. And they say to me, listen, my wife is going to leave me. You need to fix it. You know, and it is something that makes you humble to know that, you know what I mean, you could actually save somebody's marriage. And women that come in with the same thing, they're like, listen, my husband thinks that I'm cheating because I'm dry. And I'm, you know what I mean, I don't want to have sex because I'm in pain. And he thinks that I'm cheating, that I don't love him. But it's the furthest from the truth. I love him, but I just can't do it. It hurts.
How long the treatment lasts in the case of women? It wouldn't last in perpetuity. It must only be for a short period.
Not really.
You can have it for about a year.
So let me
For a
explain.
year?
Let me explain that one. Sorry for cutting you.
No, you're more. You have more experience.
So let me explain. This is what we term age reversal, right? So when you do a procedure, literally, we're turning back the hands of time. But when I turn back the hands on my watch, does my watch stay there? It starts marching forward again from that point. So these procedures will give you a dramatic effect, but it's in that point in time. So as the clock marches forward, maybe a year, year and a half, 2 years, you may think, you know what, I'm not as tight or, you know what I mean, as wet or as beautiful as I was, so I want more. So typically what we find is, it's not to say after a year you need it, right? It's that you just want more.
You have people coming back to you for
Let me tell you.
for treatment.
Let me tell you, I have a couple, a husband and wife, that come to me once a year, every year. Because they go on a vacation, and before they go on their vacation, they come, they get themselves sorted, and then they go.
In the case of the man,
The P shot.
He gets a P, and the lady gets an O.
She gets an O.
he gets a P shot.
Yeah.
And the P shot is for what?
It treats erectile dysfunction. So let me explain. It not only causes you to not need Viagra or Cialis, but what it does is it makes you get a firmer or harder erection, And in most cases, you even get increased size. So there are many different reasons why a man could come and have these procedures done.
Side effects, because there's side effects.
I love that question.
In everything.
Yeah.
Yes. So when you give a man a P shot, I'm sure there are some side effects.
Yes.
Yes.
You want me to tell you what they are?
Yeah.
The side effects are your girlfriend may want to divorce you because she may not be happy that you're too big.
I see. And that's a negative.
Well, obviously, if your girlfriend leaves you.
Yes.
So I'm just joking, but
Yeah.
the truth is there aren't any.
There aren't any side effects?
No.
But-
Once the
What
person
is
doing
this
it,
but?
No. What I wanted to say is it's a shot. So a lot of men that I have, or the women that I've spoken to, who their partner may be interested, the first thing they, is the stick.
which
That's
you
the
don't
only
feel.
thing. You don't, yeah, but men tend to have
You
a
don't
fear
feel the
of
shot?
sticks. Yeah.
Okay.
No. So there are protocol ways of doing it. So one of the things I want to make clear is I am not here to train Nina. I'm here to validate her and take her to the next level, which is what we term expert level, right? However, there are people who, they just go and think, they watch YouTube or something and they figure they could do it, right? So that's why we have what we term the Cellular Medicine Association. So we're the guys that validate and make sure that you're doing it properly, you're doing it safe, right? There recently was an outbreak I can't remember where it was, where somebody got infected with HIV. And that was because this person didn't know what they're doing, right?
They weren't a part of Vampire, but they...
Why you call it vampire
Well,
association?
that's the nickname.
The procedure deals with PRP, right? PRP, what it is you draw blood, like if you're doing a lab test,
Yes.
and you put it in a special centrifuge, spin it down, and it's the top part we call the plasma, right? That you inject into the patient. And so if it's your own and you know what you're doing properly, then the person, I guess a person would have had HIV, or I don't know how the person did that, but if the person themselves does not have HIV and you inject the person's own blood back into them, and it's the top part of the blood, the plasma that has all the nice juicy stuff. Yeah.
I see.
Yeah.
Yeah. So
So I when I did training, you had to, I haven't done this in Nassau. I was trained in the States, all right? And we had people that came in that we had to train on, including,
I'm going to ask you again, Bianca, where you get these guests?
Yes,
It's interesting,
it
isn't
is
it?
interesting, and I'm
It's an
most
interesting
interested
field.
in stem cells. And you also do facials with your own blood and your own
Yes.
stem cells
that's
too.
the vampire facial.
That's
I
a
see.
vampire facial. So what does that do exactly?
So Kim Kardashian is the celebrity that made all of this famous, right? So effectively what it is we separate, as Nina explained, your platelet-rich portion of your plasma, and the kits that we're using also isolates the CD34+.
What is that?
Those are blood circulating stem cells, right? So by using these, you're able to, as we term, turn back the hands of time. So, and it looks completely natural because this ain't no surgery and it's nothing foreign, right? I'm taking your blood and putting it back into you, right? And that's why, I keep stating, make sure that the person who's doing it is certified, right? Because there are measures that we put in place in Cellular Medicine Association to make sure that these things don't happen. So what happened, why that person got infected, is they probably did improper blood handling and had some cross-contamination or something, and infected a ton of people with HIV.
Where was this?
I think
I
it was
think
in
it was,
America.
I think it was New Mexico.
Oh.
Yeah, New Mexico.
Yes.
So, you know what I mean? These things happen.
And they weren't vampire, right?
No, they were not a
right.
part of the
You,
association.
in order to use the trademark of vampire, you have to be certified by their methods, and you have to be listed as a provider.
And the certification is done where?
I did mine. It's different places, but I did mine in the United States.
Okay.
So, and you have to be listed as a provider. So, I'm the only provider for the Bahamas.
For the Bahamas.
Yes,
Yeah.
sir.
And my thing is, you know, so I'm the educator over the Caribbean. So my role is technically to support physicians and provide additional training. And as I mentioned, for me, it's to validate Nina as an expert.
Interesting. Thank you so very much.
Thank you, Pam.
I appreciate this information. And I'm sure there are people who are watching this program who are going to see Nina Graham, Dr. Nina Graham, very soon. So they can save a marriage or whatever else, or save, like you say, save a girlfriend. Eh?
Yeah.
Mm.
Well, some guys, you know, they, as we say, all men are greedy. You can never have enough.
I see.
No, but there are some women who may just save themselves. It's very, the confidence level does a lot.
Increased confidence level.
Yeah.
And you get the Oshot.
Oh, yeah.
Or breast lift, or hair restoration. I mean,
A whole bunch of stuff.
It's extremely demoralizing for a woman who's lost her hair. You know, and to stop and reverse that, it's life-changing.
Thank you so very much, Doctor.
Thank you for having me.
Thank you, Dr. Nina Graham and Dr. Damon Gordon for being here today. Thank you, Bianca.
Thank you.
You have brought some wonderful guests today.
It was a wonderful show.
Yes, all the best. Thank you. Good evening, everyone.